Economic challenges for Ontario have resulted in increased pressure on healthcare budgets. These challenges have again resulted in cuts to registered nurses, cuts to healthcare services, and bed closures. The provincial government has told hospitals to prepare for funding increases that will be less than the cost of inflation. More than 1,600 RN positions have been cut in the past 8 months, but ONA is fighting back to preserve quality patient care. ONA's Cutting Nurses, Cutting Care campaign has continued to get the message out that cutting nurses will mean cutting patient care. ONA is joining with unions through the Ontario Federation of Labour to fight these threats to quality care and cuts to the public sector in advance of the 2010 Ontario budget. Through the Communities That Work campaign, launched by a working group of OFL and its affiliates, we have kept the pressure on the government to preserve and create good jobs.
What do you think Premier McGuinty should focus on in the next Ontario budget?
Well, where I live, the main thing is jobs.
Saving jobs.
Creating jobs.
Good jobs you can raise a family on.
People want to work.
People need to work. This budget has to create some jobs, not cut them.
Good jobs.
I just can't do it anymore. I can't survive working part-time.
Create jobs and the economy will come back.
I want my kids to have good jobs.
It all starts with jobs.
Support a good jobs budget. Find out more at communitiesthatwork.ca. Quand les gens sont au chômage, les familles en souffrent. Les entreprises perdent leurs clients et les communautés luttent pour s'en sortir. Nous sommes tous reliés. Et c'est pourquoi c'est si important que Dalton McGuinty fasse le prochain budget de l'Ontario uniquement pour sauver et créer de bons emplois. Un budget favorisant de bons emplois aidera les familles, les entreprises et les communautés à se remettre sur les rails. Pour en savoir plus, visitez communautéautravail.ca.
When people are out of work, families suffer. Businesses lose their customers and communities struggle to get by. We are all connected. And that's why it's so important that Dalton McGuinty makes the next Ontario budget all about saving and creating good jobs. A good jobs budget will help families, businesses, and communities get back on track. Find out how. Visit communitiesthatwork.ca.
ONA is committed to its members' quality of work life. Recently, ONA's board endorsed the request of members at Hamilton Health Sciences Corporation to censure the hospital.
We would prefer, instead of fighting with them, it's been a long, hard year here at Local 70. We're on the battle lines every single day, and it just never seems to get any better. We really appreciate having you behind us. We know that you're there now. You told us strongly in your censure vote that you're behind us, and we're going to make it better, and we know that we've got you to help us. Thank you, everyone. Yay! Woo!
The extensive media coverage that resulted ensured that the community understood the position of registered nurses. The community is supporting RNs and their desire to provide quality patient care. ONA continues its efforts to eliminate workplace violence. ONA President Linda Haslam-Stroud appeared before the Queen's Park Standing Committee on Bill 168 to suggest amendments aimed at strengthening the legislation.
Given us some very specific amendments that we can look at and try to incorporate. So, thank you.
Progress has been made.
Thank you, Mr. Chair.
There have been threats to other sectors. Canadian Blood Services is planning to cut registered nurses out of the screening process in permanent clinics. ONA's efforts have been ramped up with its participation in a country-wide campaign organized by the Canadian Federation of Nurses Unions. A new website urges the public to fight the cuts to RNs. ONA has been advocating for its members through work with allies. The Ontario Federation of Labour Convention saw the premiere of a sexual harassment video for young workers, developed with ONA input and support, featuring ONA member Barb Porter discussing the Laurie DuPont case.
Afraid of what he's going to do to me, do to others up here. I will refuse. I will not work with him anymore.
But we have lost 1,265 RN positions in the last 6 months because of the balancing of hospital budgets on the back of nurses and the other healthcare workers that we represent across Ontario. It is a shame.
OFL delegates passed ONA's resolution calling for the OFL and affiliates to lobby government for improved funding for public health nursing programs and to reverse public health cuts. Also at the OFL Biennial Convention, ONA bid a fond farewell to outgoing OFL President Wayne Samuelson and saw a new president acclaimed.
We bring in racialized minorities, we bring in social activists, we bring in environmentalists, we bring in anybody who feels that they can help.